Hello, my name is John Franklin, and this is a mini lecture on atherosclerosis as part of a Bio 54 summer assignment with San Jose State. I will begin this lecture by talking about how atherosclerosis fits into heart disease, what atherosclerosis is, and then I will cover how diet, lifestyle, and genes contribute to this disease. I will conclude with a discussion on why we seem incapable of getting rid of this disease. So what is heart disease? It's essentially any disease that negatively affects the cardiovascular system. That's the system that controls the circulation of our blood throughout our bodies. Heart disease includes atherosclerosis, arrhythmia, which is when the heart beats irregularly, hypertension, which is when we have high blood pressure, and others. When heart disease is mentioned, typically a person is speaking of atherosclerosis, since it is the most common form of heart disease. Atherosclerosis is an inflammatory response that causes the wall of the artery to expand, thereby restricting the flow of blood. Typically, it takes decades to develop before it presents a health risk. It can lead to heart attacks, strokes, and is the #1 cause of death in the Western world. Yet, it is still poorly understood. I will tell a little bit about the history of this disease, and then I will present, to the best of my research, how we understand atherosclerosis today. The beginnings of atherosclerosis can be found in the 1860s when plaque was first observed within the arteries, though little to nothing was understood of its composition or origins. Then, in 1910, a German by the name of Adolf Windaus found that the arterial damage from atherosclerosis had 6 to 20 times as much cholesterol as a normal artery. About the same time, a Russian by the name of Nikolai Onychkov identified the monocytes and foam cells present in atherosclerosis. In addition, Onychkov discovered that feeding rabbits high cholesterol diets induced atherosclerosis. It wasn't for another 40 years, that is, in the 1950s, that further progress was made in atherosclerosis. Researchers found a correlation between the presence of low-density lipoproteins and atherosclerosis. In 1952, another study showed that avoiding animal fats and instead eating plant foods significantly reduced the cholesterol level present in the bloodstream. This caused what is now called the lipid or cholesterol hypothesis, in which it is theorized that because eating saturated fats leads to higher levels of low-density lipoproteins, saturated fat causes atherosclerosis. Though researchers know that low-density lipoproteins play a part in atherosclerosis, it is not known whether they cause or simply play a part in the process. Regardless, evidence indicates that atherosclerosis begins when damage occurs to an arterial wall. This can be the result of high blood pressure causing too much stress on the arterial wall, or by chemicals introduced from smoking. Regardless of how the damage occurs, the inflammation process begins when low-density lipoproteins, those are the agents that carry cholesterol through the blood, get stuck in the endothelium. That's the name of the wall of your artery. Chemical reactions occur within the cell wall, causing the small-density lipoproteins to oxidize. When this occurs, the cell walls respond by creating a sticky surface that attracts monocytes, which are a type of white blood cell. These white blood cells form into macrophages in order to digest the cholesterol found in the endothelium. These macrophages begin the first step of healing the endothelium by bonding to the oxidized low-density lipoproteins and becoming large cholesterol carriers. These macrophages become what are known as foam cells. They grow in size and rupture, spreading more cholesterol into the endothelium. This causes more monocytes to rush into the area, causing a repetitious process. As more foam cells become present in the endothelium, the cell wall pushes into the bloodstream, causing a restriction in blood flow. Occasionally, the division between the bloodstream and the plaque within the endothelium can rupture, causing cholesterol to spill into the bloodstream. This creates clots that can block a blood vessel completely, resulting in a stroke or heart attack. So what part does diet play in this disease? Some would say very little, due to the fact that nearly 80% of the cholesterol in your blood is from your own liver, where it's produced. Only about 20% comes from your diet. However, there are no doubts that the diet can increase low-density lipoprotein count, and that these particles are involved in the process. In addition, some studies report the benefits of a diet rich in high-density lipoproteins, which seem to be able to reduce atherosclerosis by causing an absorption in the number of low-density lipoproteins in your bloodstream. Does this mean that a person should use their diet in order to lower their low-density lipoprotein count? Not necessarily. Some studies report that once a person has atherosclerosis, reducing low-density lipoproteins is dangerous for the person's health. For example, a study conducted in 2009 found that nearly half of the 517 patients had healthy levels of low-density lipoproteins and yet suffered from more deaths than those above 105 milligrams per deciliter of low-density lipoprotein. To give perspective, 100 milligrams per deciliter of low-density lipoprotein is considered ideal for people at risk of heart attack. So if this is ideal, why are people with counts below this dying more frequently from heart attacks? Or, in another study that involved 650 stroke patients, it was shown that those with higher levels of cholesterol suffered from less severe strokes and actually had a lower rate of death than those with lower levels of cholesterol. These studies present significant issues for the lipid hypothesis. It is possible that other factors more directly contribute to atherosclerosis. For example, consider our genes. People can inherit certain genes that predispose them to atherosclerosis. For example, the right mix of genes can result in a condition called familial hypocholesterolemia, which about 1 in 500 people have. People with this condition produce significantly higher levels of cholesterol than the average person, and are therefore at risk of getting atherosclerosis. In addition, there is a gene variation called GPA2-MET, which makes blood more likely to clot, which can result in a vascular occlusion. There is also a gene called APOE4, which fails to reduce certain inflammation agents, as its brother variants do, and thus arteries are more likely to inflammate and generate atherosclerosis. While these genes do predispose a person to atherosclerosis, there is also the role that lifestyle plays. The most significant lifestyle factors include smoking, stress, obesity, and physical activity, which can all cause heart disease or atherosclerosis, but in different ways. Smoking introduces chemicals that cause damage to the endothelium, which can cause atherosclerosis beginning from a young age. Stress can cause atherosclerosis in two ways. Stress can cause a production of stress hormones that accelerate the development of plaque, and stress can also raise blood pressure, which may result in plaque rupturing and causing an arterial occlusion. Obesity has perhaps the weakest evidence for causing atherosclerosis, but it does show a correlation with the disease, similar to low-density blood count. Exercise can, if vigorous, increase the risk to a person having a heart attack. On the other hand, regular exercise can lower blood pressure and create new blood vessels while expanding existing ones. This means that blood can be rerouted from blocked passages in times of need. So while the person may still be developing atherosclerosis, it will pose a reduced health risk. I'll talk now about treatment options. There are some known substances that will reduce the risk of heart attack. For example, aspirin is effective in thinning the viscosity of the blood and preventing clotting. There are also more powerful anti-clotting agents available that healthcare professionals can provide. In addition, there are statin drugs, though the efficacy of them is highly debated. For example, in a Swedish study of 2 million people, it was observed that taking statins did not reduce the rate that people suffered from heart attacks, nor did it decrease their mortality rate. In another study on the effects of statin drugs, it was noticed that although statins decreased low-density lipoprotein levels, they also increased the oxidation of the low-density lipoproteins that were present. This means that statin drugs could make the low-density lipoproteins that are present more atherogenic. As a person's atherosclerosis develops and artery blockages surpass 50 to 60% blockage, health professionals can resort to a number of means to ensure blood flow, despite the atherosclerosis. For example, surgeons can install catheters to expand a channel, stents to keep a channel expanded, or insert blood vessels from elsewhere in the body to circumvent the currently blocked passages. Another means to reducing the person's health risks, despite atherosclerosis, is to stabilize the existing plaque. For example, in a study of 60 patients, the University of Washington used drug therapy in combination with low-saturated fat diets to reduce the lipid core of the atherosclerosis. The decrease in the lipid core stabilized the atheroma and helped prevent a plaque rupture. But wait, in that study, they used a low-fat diet. Did this cause the regression of the lipid core? Probably not. Studies that only examine a low-fat diet do not report a regression in atherosclerosis. So why is this disease so hard for us to avoid? There are several reasons. First, the disease takes decades to develop, and so people aren't necessarily aware that they have atherosclerosis. In addition, the lifestyle that would help stave off the disease, such as exercise, good diet, and low stress, are hard for many of us to obtain in the modern world, where we sit in one place for the majority of our workday, work long hours, and have stress-filled lives. In addition, we are constantly surrounded by fatty foods. But perhaps there is more to it than that. A study from this year, 2013, shows that our ancestors from thousands of years ago also suffered from this disease. About a third of the 4,000-year-old mummies studied also had atherosclerosis, and this was from all over the world. Not only that, but in another study, it was observed that there was a relationship between the efficacy of bone marrow progenitor cells and atherosclerosis. That as we get older, these cells that ordinarily can transform into endothelial tissue and repair that tissue lose their ability to transform into these cells. This raises the possibility that atherosclerosis is a natural process that is a result of aging. My advice to anyone who wishes to avoid this disease is to exercise, avoid smoking, and maintain a proper weight. Delay the development of atherosclerosis because it seems that once it develops, it rarely goes away.